Wrap this tape, yeah.
Oh, there we go.
We just got it.
Perfect.
Okay.
Excellent. Thank you all for joining. My name is Philip Shetson. I'm the president of Bona Vita Benefits Group, a boutique benefits consulting and brokerage firm who has partnered with the leadership of Field of Dreams to help navigate the transition of one benefits program to our next benefits program. With us today on the call are Milagros Biggs, a senior account executive, and Amy Tarazona, an implementation specialist on our team. They're going to be there to support you throughout this education process as well as beyond. If you have questions, whether they be pertaining to certain medications you're taking or how the programs work, or you have an upcoming procedure, in July or August that you want to make sure you're prepared for, our team is there to support. So without further ado, today's presentation should take about 40-45 minutes. I'm going to kick this off to Amy and Millie, who will begin the presentation. Thank you so much for the partnership, and we look forward to being of service to everyone at Field of Dreams.
Thank you, Phil. Okay, with that being said, do you want to say?
No, hi, I'm Millie. This is Milagros. Much easier to call me Millie. It's great to have everyone here, a room full of ladies, and love it. This is a first, so we're gonna go on ahead and like Phil said, at the end, if you have any questions for us, let us know. You need to speak to us privately. Let us know as well. We're here for about another 2 hours. So we're just here. Our information is on the last page. You can always reach out to us via email. But with that, I'm going to pass it over to Amy. And as we go on ahead and go through the benefits presentation, as well as Mike, who's here with us from AFLAC, who will also be going through some supplemental insurance towards the end. Okay?
Thank you, Millie and Phil. Like they said, my name is Amy. I'm here to provide you guys with support, all of us here at our team, not just today or in the next 2 hours that we'll be here, but provide you guys with year-round support with anything that comes out throughout the year, whether it comes to claims, medication. I've worked in medical billing for over 4 years, so I'm very familiar with how billing works, and I can always tell if a bill looks off. So if anything ever comes up throughout the year, I'm more than happy to assist you guys. So with that being said, we're just going to go ahead and talk a little bit about overview with the medical benefits and all the benefits presented to you guys today. So they will be offering a medical plan through Cigna. There's going to be dental and vision insurance, as well as basic and group life. So you guys are actually all going to be automatically enrolled into basic group life insurance. If you choose to enroll into voluntary life insurance, you do have that access as well. There's going to be the HRA, since I know the QSAR is now going away. But no worries, there is going to be an HRA or health reimbursement arrangement that will actually be talked about in today's discussion. And then we're going to pass it off to Mike later to talk about the AFLAC benefits. Okay. So just talking a little bit about the transition timeline for today and until your benefits become active on July 1st. So of course, open enrollment did open up today. Open enrollment, as you guys know, is that one time of the year where you guys can go ahead and enroll into benefits or waive them if you are going through a spouse or anything to that sort. So open enrollment opened up today and it will end on June 9th. So that's actually about 2 weeks from today. You guys should have received an email from Employee Navigator. That will be our benefits enrollment system. If you guys did not receive that email, we always just ask you guys to check your spam. Sometimes for some reason the emails go there. Or if you still haven't received it, then we'll just talk about it after the presentation to make sure we have the right email. So as I mentioned here, this is for benefits for July 1st. So any updated pay deductions for any of the benefits we are talking about today will take into effect after July 1st. Everything currently right now is just your current deductions of whatever you guys are enrolled into right now. But everything that will be updated for the new benefits will be after July 1st, not before. Okay. So if you guys decide to waive benefits because you have them through your spouse, you have state insurance or anything to that, or you simply don't want to enroll into the benefits, that is completely fine. However, you guys are not able to enroll outside of this enrollment window between today and June 9th unless you experience a qualifying life event. Qualifying life event being things such as marriage, divorce, birth or adoption of a child, or loss or gain of other coverage. That will be the only times you guys are able to enroll outside of this window. If you simply just chose to waive because you weren't interested and you call us, our team, in 2 months to say, Amy or Millie, I want to enroll into the benefits, we're unfortunately going to say no, unless you experience a qualifying life event. That is just limitations to the carriers, because of course they have to have proof for why you will be enrolling outside of the window. Okay, so if anything comes up throughout the year, of course, if anyone ever experiences a qualifying life event, we always just ask if you can let us know within 30 days. For example, if you are with your spouse and your spouse lost his job and you guys lost coverage, if you can tell us within the 30 days, that just helps us get you guys all of your ID cards ready, and then of course have it updated for your pay deduction, so you know there's no sort of scrambling or anything last minute if something catastrophic happens. Okay? All right. Again, just a little bit about an agenda. We're just going to talk about the enrollment system, Employee Navigator. We're going to talk to you guys about how to navigate the system, how to add dependents. We already preloaded the system with all of your information. However, we just ask that you guys double check just to make sure everything looks correct on your end. Okay? So Employee Navigator, that is going to be the enrollment benefit system. AFLAC will be separate with Mike. But for the benefits that are listed for the medical, dental, vision, and group life, that will all be through the Employee Navigator system. You're going to be receiving an email, hopefully, if you guys haven't been able to locate it already, it's just going to ask you to agree to the use and policy. You're going to create an account. It will ask you guys for a unique identifier where it's already located in the email, but sometimes it gets lost. It's just going to be a unique identifier that you just have to type a code. And along with your personal information, you'll be able to register an account. Okay, if anyone has any sort of preference for a language, you can change it into another language if you prefer. You're going to see your taskbar looks something similar to this. It's kind of hard to see here for you guys, but you guys are going to verify your personal information. As we mentioned, it's already been preloaded. You can add dependents if you're interested in enrolling them, and then you can select the coverages for each benefit. I did want to emphasize as well, if you want to enroll, for example, yourself for the medical portion, but maybe but maybe the dental and vision looks better, you can enroll your children or your spouse onto that. It's not like a package deal where you have to enroll every single, dependent onto every single plan together. You can specify the benefits, but of course you do need to be enrolled onto the benefit. Okay. And you also will be seeing the per pay period deductions as well for each benefit. It's going to ask you to enroll or waive into the voluntary life insurance. It is a toggle bar, so you can scroll it all the way up. Once you see it turn red, turning red will simply simplify that you will need to provide evidence of insurability, which is simply just letting the insurance carrier know that after you go ahead and enroll to a benefit amount, I'm going to just give an example because I don't remember the exact number. If it's 150,000 and you try to enroll into more, Principal is the carrier for the life insurance. They're just going to send you a questionnaire, which is simply, I always like to give a quick example. If you were to go to the doctor and they ask you for your medical history, or you kind of fill out that questionnaire, it's something similar to that nature, that you will have to provide that questionnaire and then the insurance will agree to you. And we'll talk more about what the actual guaranteed issue amount, because I can't remember from the top of my head. And you're going to go ahead, once you're finished with that, you're going to see all the benefits that you selected. If you want to make changes or edits, you're going to see the per pay period costs all totaled up at the end, and then you can continue with your enrollment and you are complete. And of course, me and Millie are going to be here for about another 2 hours or so. So if you already guys know what benefits you guys want to enroll into, we can go ahead and complete it for you guys today, so you guys don't have to worry about completing it within the next 2 weeks. Okay. So just going on to some key terms, I know they might be a little hard to see from here. We always just like to go over some key terms just to help you guys kind of understand more about how medical insurance works, because a lot of the times these terms are thrown at you guys and you guys are expected to be experts and know what they need. And then when you see the benefits, you're kind of lost on which ones are better for you, right? So a deductible, in short, is just the amount you must pay before your insurance pays their share of costs. I always like to give a quick example of car insurance. If anyone's ever suffered an accident before, hopefully not, but if you've had Geico insurance, for example, I get into an accident, Geico says, Amy, you need to pay your $500 deductible before we go ahead and pay our share of cost of the damage. With medical insurance, it works rather similar, because up until you don't pay the deductible, there are no costs from the insurance that they're paying, right? However, they do pay on, this doesn't apply towards services like preventative services. So if you're going to your annual physical, your annual blood routine panel, you don't meet the deductible for that. That's still going to be covered at 100%. Deductible usually only applies to major services. These pertain to something like radiology, if you need to get an MRI, a CAT scan, if you're hospitalized, if you have to go to the emergency room, if you have to have a major surgery. These will always be services that require you to meet the deductible. And up until you meet that deductible, there's not going to be any payments from the insurance. Okay? So the next term here is the out-of-pocket maximum. As said in the name, that is the most you will pay in the calendar year. Calendar year referring from January 1st to December 31st before it resets to zero for the next year. This basically essentially means the deductible lives inside of that out-of-pocket maximum. The out-of-pocket maximum refers to the most you will pay for covered medical services in the calendar year before you are actually free of paying all costs, meaning you will not have to pay anything anymore. You're going to see in the next couple slides that the out-of-pocket maximum is, of course, higher than the deductible, but the deductible lives inside of the out-of-pocket maximum. You guys, I believe, if I'm not mistaken, it's the $3,500 deductible plan. I think the out-of-pocket maximum of $7,350 for the individual. So essentially, it's the $3,500 that lives inside of that $7,000 number, and then you kind of receive the $4,000 would be in things such as co-insurance or co-pays. Co-insurance is another term here on the next term here. Co-insurance is a fixed percentage amount that is also paid on covered medical services. So for example, if it is 20%, that means that the insurance pays the difference of 80%. Co-insurance, however, always kicks in after you've already met the deductible. So it's never going to be co-insurance and deductible. I always rule of thumb, it's you meet the deductible, co-insurance, all of that lives inside of that out-of-pocket maximum. And co-insurance you're going to see applies to those major services, such as the radiology, hospitalization, surgery, everything to that nature will apply towards co-insurance and deductible. A term that you guys are probably more familiar with is copays. Copays is a fixed dollar amount that you pay each time of service. They're typically split into two categories: primary care and specialist copay. Primary care is your provider that you generally see for everything. Your physical, if you're feeling under the weather, you see your primary care and you pay your primary care copay. Sometimes your primary care isn't able to fully treat you with something. Maybe they see something wrong in your results. They say, Amy, I see something is wrong with your heart. I want you to go see a cardiologist. Cardiologist now falls into the category of a specialist copay. And for that reasoning, I will be paying my specialist copay. And you're going to see that the specialist copay is typically a little bit higher than the primary care copay. They're generally not the same. Okay? Any questions on any of those terms so far? Okay. So for the medical insurance, the network is going to be Cigna. I'm sure you guys are familiar with Cigna. It's one of the big major four carriers. However, Cigna is actually just the network that is being used. Securus Benefits is the TPA for essentially the third-party administrator, where essentially Cigna is a lease network, which sometimes gets confusing, but when your providers are billing your billing Cigna, billing for whatever services you have happening, they need to bill Securus Benefits, not Cigna, because if they were to try to go ahead and bill Cigna, Cigna's going to come back and say, Amy doesn't exist in our system. That is because they need to bill Securus Benefits, and that is in big letters on the back of your insurance cards that say, please do not bill Cigna, bill Securus Benefits. When they look you up in the system for your eligibility before you go see your provider, they need to look you up through Securus Benefits, not Cigna. A lot of the times it gets told, you guys might call us and say, my doctor's saying they can't find me in the system. I'm like, are they looking you up in Cigna or are they looking you up in Securus? They say, because most of the time I'll get on the phone, I'll go ahead and fight with you guys. We'll fight for you guys and the doctors. I'm like, are you guys looking up this patient in the right system? They'll be like, oh no, we actually were. I'm like, yeah, no, you have to look him up in Securus Benefits. That way, because then of course they jump the gun, they'll see Cigna, and then they decide to go bill Cigna. So we just want you guys to be aware, and it is said on the back of your insurance card. It is going to be an in and out of network plan. In and out of network, for anyone that's not familiar with what that means, network essentially means that your providers have a negotiated contractor rate with Cigna where they cannot bill you past a certain amount. So the visit might cost me $500, but my provider's negotiated rate with Cigna is $250, they can never bill me more than $250. The rest, they eat up the costs. Out of network is the opposite. There is no negotiated rates. For that reason, they don't have to bill you past out. They can bill you as much as they want. If the visit costs $500, they can bill you the full $500, but only a fraction of that gets applied towards your out of network benefits. And for that reason, we always try to tell you guys to stay in network. I know there might be some people that are loyal to a provider, but with that, out of network is a lot more costly, and we always ask you guys to go ahead and stay in network if you can. Okay, so it's hard to see on the screen here, but the cost sharing, it is the $3,500 classic PPO plan. The individual deductible is $3,500. If you were to enroll with the family, it's $7,000. So what does this essentially refer to? I see some confused faces here. For $3,500, if I enroll by myself, I pay my individual deductible of $3,500, and I'm complete. Once I meet my $3,500, I'll have the 80% co-insurance that my carrier will pay, and I pay, of course, the difference of 20%. The $7,000 refers to if I enroll with the family, if I enroll with my spouse, if I enroll with my children. We all need to meet the $7,000 deductible before we can pay our co-insurance of 80%. However, I always like to remind that you guys will never pay more than your individual deductible. So for example, if me and my spouse each met our individual deductible of $3,500 and we have our newborn that's also enrolled onto the plan, but me and my spouse have already met the deductible, the family deductible, our newborn is free of the cost because we'll never pay more than the $7,000 or more than our individual. So essentially, they do not need to meet the last remaining costs. You guys will be then ahead going to pay the co-insurance of the 80%, or I'm sorry, the 20%. Same concept applies for out of network as well as your out of pocket maximum. You can see the numbers, like I mentioned earlier, that they are a lot higher. So we always say stay in network because of course you see that the out of network is a lot more expensive and a lot harder to meet. And these numbers reset on a calendar year. So I know we're starting in July until the end of the year. Everything that is accumulating is from July until December 31st of 2026. Come January 1st, 2027, everything will reset to $0 again. It does not carry over or accrue to the next year. It resets to 0. So we just want you guys to be aware. Okay, any questions on those? A little bit now about some more cost sharing information. The primary copay is $45. For a specialist, it's a $90 copay. Like I mentioned, services like the radiology, emergency room, hospitalization, surgeries, those are required. You see here 20% after deductible. You meet the deductible and then it's 20% of your responsibility. The insurance takes care of the rest. However, that only assumes with the assumption that you've already met the deductible. Urgent care is also a $90 copay. I know for the medications are kind of hard to see here as well, but it's split into 3 tiers. Tier 1 refers to generic branded drugs. So for example, amoxicillin, you won't pay more than $15 worth of amoxicillin. Tier 2 refers to preferred branded drugs. If you guys have any specific drugs that maybe you can't take the generic, that is going to be a $65 copay, no more than $65. And then tier 3 refers to non-preferred, and that will be a $100 copay. No more than $100 you'll pay on a non-preferred drug. Okay. So now we're going to talk about what happens now with the elimination of QSARA. There's going to be the HRA, the Health Reimbursement Arrangement. There's going to be 2 benefits offered. The first one is just a simple HRA. So for individuals who are going to enroll into the plan, if you're enrolling by yourself, you will have access to $3,000. If you're enrolling with your family, it's going to be $6,000. If, for example, you guys are waiving because you guys are on your spouse's coverage, you guys have access to $6,000. And that's, of course, only applies for medical services. You can't, you won't get $6,000 to spend it at any sort of other fancy store or anything like that. However, yeah.
That one section again, right from where you did it 2 sentences ago, you just repeat that.
The spousal?
Spousal or
The
the
spousal?
You said the spouse, yeah.
Yeah.
Spouse.
So if everyone,
Sorry.
yes, so the first benefit is the HRA, health reimbursement arrangement. So if you're going to enroll into the plan, right? If you're going to enroll by yourself, meaning it's just you on the plan, you'll have access to $3,000. If you enroll with your family, you'll have access to $6,000. If you're simply waiving coverage because you're on your spouse's insurance, you will have access then to the other benefit, which is the spousal HRA, and you'll have access to $6,000. So if you're gonna waive, you'll have access to $6,000, but again, that's only for covered medical services. And I do want to emphasize that these HRAs are not eligible to be paid for premiums. Premiums meaning you guys see the per pay period cost of your medical benefits. You can't use it to pay for those. Those will have to come out of your own pocket. The HRA can be used, for example, like a copay, a deductible, but you can't use it to pay for the premiums of the plan.
Right, and I know that some of you, because I was looking when the deductible, so for someone that enrolls in the medical plan, right, if you go to page 6, you see that if you enroll as an individual, your individual deductible is $3,500, right? But Field of Dreams is giving $3,000 of their money for you to be able to submit for medical expenses, right? So what does that mean? In reality, it's not $3,500. Your deductible is $500, right? So just keep that in mind as you look, because that's why for the employee plus dependents, meaning if you enroll in any other tier, you get $6,000. And this money will accrue monthly, right? So when the benefit goes live on 7/1, it's not automatically going to be $3,000 on day 1. You're going to get, if you're enrolled as an individual, $250 each month. $250, $250, $250. And if you enroll with employee plus dependents, then of course it'll double. Okay, just to keep in mind. Yes.
So like you said, if we don't enroll in medical, we still have access to that $6,000.
So if you're enrolling, as long as you can provide proof that you're currently enrolled under a spouse's insurance, and that will not be provided to us, that you will come directly to Amanda and show her proof of coverage.
Okay. Any other questions? I see one in the back. Yeah.
That the HRA money is not spending any funds to support, but what if I need to get medicine for my kid? It is covered with the $6,000 or it's not?
Yeah, as long as you are enrolled in your spouse's plan as a family, everyone's going to get $6,000. You'll submit your eligible reimbursement through task. But again, once, even for your children, if they're, as long as they're on the plan.
No, like if, like, let's say my daughter is sick and I have to go get her medicine.
Okay.
And like, I know I can do the copay with the HRA money, but what if I need to get her medicine?
You're enrolling in the plan, right? You're enrolling with your child in the plan.
Yes.
You have access to the $6,000 and the medicine. You could be playing with that HRA card.
Over-the-counter medicine?
Over the counter, yeah, over the counter medicine.
Because she just said like
Deductible
we
different.
cannot do any purchases like.
I will actually verify how the actual plan documents will be written, because that's where the specifics will go in. Meaning if TASC would want to see an explanation of benefits, that means that you have to run your insurance. But I will partner up to see if over-the-counter medicine, because this is very different than a flexible spending. A flexible spending account, you can of course use for over-the-counter medicine. I will get you clarification on that.
So, like you said, the fancy stores, like if I go to the eye doctor and I want to get a pair of glasses and, you know, whatever brand they may be, I can do that.
This is just for, so which HRA, spousal or medical HRA?
If you're enrolling onto the Field of Dreams plan,
No,
you're gonna waive it.
I mean, yeah.
Okay.
Yeah, don't need the insurance.
Yeah,
Yeah.
Yeah, no, it's
Then that's.
the age for spousal.
Now, again, we will check the plan documents on C for dental for eyeglasses, because this is just intended for medical. Meaning if you, what does that mean medically? It means they're listed what they call in a fancy term 213D expenses. 213D expenses are basically medical eligible expense, co-pays, medication. You need specific, I can get you a list,
Contacts, glasses.
but it depends,
braces.
because that goes into dental and vision.
Yeah.
Very
That's separate from
But
medical.
that's $6,000 we get.
Again, I will find out through task, because at the end of the day, what's gonna govern this plan are the plan documents. So I will ask them.
So it only
That will get
applies
back
to
in.
medical, not
Correct,
to vision.
correct, but I will ask.
Those are separate. Okay. Okay. Any other questions before we continue?
Are we
Yes.
entitled to the spousal HRA without the medical? That's a big.
We're going to double check with that, just because like we said, this is only intended for medical, but we're going to double check just to verify, because I'm sure that's probably a deal breaker for all of you guys here.
Yeah, I mean, just for
Original.
example, for myself, my husband has very good medical
Okay.
insurance.
Mhm.
So right now, my FSA that we have now is covering my copay for $15 for amoxicillin. $10 for
Right.
whatever medicine my daughter takes.
Right,
Stuff
right,
like that.
right.
So.
Because an HRA is a lot different than an FSA. Because an
Correct.
FSA is a lot more flexible. HRA is a lot different because it's very specific, because of course with these are designed for medical, but
And
again,
HRA is employer sponsored.
right, because the employer is giving you
Correct.
guys, Field of
Right,
Dreams
what
is,
we have now, so it would be just a matter of, do I go with your medical? Or can I just take the HRA and continue what I'm doing now?
Well, no, you wouldn't be able, so if you decide to waive your medical coverage, you
Correct.
won't have access to the HRA from the employer. So you see the 3,000, 6,000, you would have access as long as you provide proof that you're enrolled on your spouse's plan.
Right.
You will get enrolled into the spousal reimbursement arrangement, which
What
is
we
the
have now.
6,000. It's very different from the Cusera, because
Completely
Cusera,
different.
at the moment you're paying, you could use to pay premiums, am I correct?
Yes.
Cusera on this, it's not.
no longer, yeah, completely different than that.
Right.
Yes, okay? So the next benefit here is dependent care FSA. Dependent care is of course subject to the IRS, so for everyone here, it's 7,500 per household, meaning per family. That's what you guys will have access to. If you're going to be filing separately, meaning it's just yourself, it's going to be 3,750. And the actually Field of Dreams is generously contributing 2,500 towards the dependent care FSF. I hope that's, yes.
Sorry, what age does the dependent care go to?
So there's not an age, it's just gotta be used for qualifying expenses, daycare, summer
So
camp.
my 15-year-old.
Correct,
yeah,
Correct. It's very different than when you're thinking of like a dental or vision age off till age 26.
The two share we now have the same, but there's a limit of 8 days as well.
Well,
That's why they go through the same limit.
no,
Yeah, of course.
no, there, I believe 15 you should be good, but I will ask, I will ask Task. I'm asking Task right now.
Okay. Any other questions on the dependent care FSA?
I'm sorry.
Okay, yeah.
How do we get dependent care? Is that part of?
Yes, you guys, that will be part of the enrollment system as well. That's part of your benefits as well. So you guys are going to be able to elect how much you want on the enrollment portal.
Same as you have today, right? Some of you are, not everyone is enrolled into a dependent care FSA. Same thing, it's just a different vendor. So instead of the current vendor you're using, it's going to be changed over to Task. That is who's going to be managing the health reimbursement arrangement, the spousal arrangement, as well as a dependent care FSA. You'll see the vendor is going to be Task, will set you up, whoever enrolls, they have a portal, and you'll be able to also have access to it, okay?
Okay, so just moving on from the medical portion, we're going to talk about the dental and the vision insurance. They're both going to be offered through Principal. For dental insurance, it's going to be, of course, there is a deductible of individually of $50.
Yes.
For a family, it's $150. So remember the same concept applies. If you're enrolling yourself, $50 deductible. If you're enrolling a dependent, it'll be $150. Okay. For preventative services, this is your 2 times a year cleanings. That's going to continue to be covered at 100%. For basic services, it's going to be 80%. And for major services, it's going to be a 50% co-insurance. And the maximum benefit for the year for the plan is going to be $1,500. So you'll be covered up to $1,000 and $1,500 for covered dental expense.
Now, this is
Yeah.
a question, if you're going to take, if you're going to, I'm under my spouse's insurance as well. And if I get the 6,000 that we're allowed to partake in, can I use that to go for my extra cleaning year?
Right, so that's what we mentioned before, we have to double check. Because that's only, like for what we're seeing here, it's intended for medical only. So we're double checking it on the back end if we can use this for dental and vision, because dental and vision are separate benefits.
And you said it's only 1,000 for the dental,
1,500
for me, or for the whole family?
for per person. So if you and your spouse enroll, each person has access. Yes, ortho is not available, unfortunately.
For the people that can't see.
Yeah, yeah. Yes, so there are unfortunately no ortho benefits covered. Yes.
Can we get paperwork on what is covered?
Yeah, it's actually also on the enrollment system as well, so we actually have a summary of plan documents for all the benefits listed here today. And if you guys, of course, we can walk you guys through the enrollment system, so you guys can also see the documents as well, for what's covered and what's.
And that was all mailed to everybody today?
No, that's on the enrollment system, so you guys should have received an email, and we'll walk you guys through your registration portal.
Yeah.
Okay, no worries, we can reprompt it again to send it to you guys again. Sometimes it goes to spam, but we'll reprompt it after today's presentation. Okay? Any other questions?
Amy, I think Philip said he was gonna send it after the meeting.
Oh,
I
he's gonna
emailed
send it
him
after?
prior to it, yeah, it was supposed to send at 12.
Probably didn't.
Oh.
Okay, any other questions on the dental?
Okay.
What's the email coming from? Just your.
Employee navigator. If you guys don't see it, there's probably a chance it probably didn't send, so we can just reprompt
Yeah.
and send again.
We'll reprompt it, and then just a little clarification, because I know that you asked about the spousal, right? HRA for dental and vision, right? You're good, you can submit dental and vision, you'll get 6,000, right? You could submit dental and vision, but you'll only be capped out at 6,000, and it'll still accrue the same way month.
So
Right.
500 a month.
We're waiting the
Correct.
medical, we're waiting the medical benefits.
Correct.
But we could still go to the dentist to the actual meeting and submit that way.
Yes, so she confirmed it, okay, great.
I had to confirm it, that's why I got on the phone.
Yeah,
If you have, if I was like an out of network dentist, who was $6,000 kind of prior towards that.
But here's the thing, remember, it's not going to be front loaded immediately, so if you
No,
go
I
to.
know, but like, if, like a cleaning for my kids,
Mhm.
a couple $100 and I have the money.
You can use it as
So
long
I
as
can use, I have to apply it to an out of network dentist.
out of network, no, it doesn't matter if it's out of network, it's just as long as it's dental and vision. So as long as it falls under like I said, those 213D expenses, and I'll show you guys later what a list is if you guys are ever curious. That's basically what tax will cover, right? When it comes out of that, they're like, no, and they'll give you pushback. We won't, as it's for us, we'll approve everything. But they have their own process. In order to keep the plan compliance, they need to ensure that are these 213D expenses. So in out of network, as long as you have an invoice and you're submitting proof of payments, it'll go through.
Okay, there's one more thing, I don't know if you want to, or not. But let's say I go for dental work and I have to pay, my insurance is I'm on like my spouse's. insurance. So let's say it covers $1,000 and I owe $300. I can also use that towards.
Right, but then you would submit in that case, you would submit along with your paid and EOB. All dental vision generated an explanation of benefits of how much the carrier covered and how much you are remaining to pay. Because you're never going to pay what the carrier already paid. So does that make sense?
Yeah, I need to pay for it upfront. Or.
You all will have a debit card.
Either for the same thing.
Correct.
As for Sarah, so you need like the company, the data service, what the service was and what you owe.
All right.
Underscore, right?
You'll still have the same card that you're able to swipe. If ever you run into an issue, you automatically get an email from Task, right? Task will say, hey, you did this on this date, we need further documentation. And we have, whoever have pushback to the point like, hey, Millie, I submitted, I did everything, it's a vision claim, but it's still not going through. You can partner up with us, and we have account managers internally that we partner up with to see where is the issue. Huh?
Oh, there's no direct number that you can call to
Yes. But if so a lot of the times when an employee gets denied several times, they reach out to us directly, because sometimes that's silly as we need a different invoice. And it has happened, they could be like, no, we don't like the invoice she sent because it's just saying she paid 25%. They need to see an itemized.
itemized. Yeah, and we also want to save you guys the time of having to call them, we can just take it care when we have direct access to our accounts. Okay? So just moving on to the vision, it's offered through Principal, but the network is VSP. For your Annual exam, it's gonna be a $10 copay. For lenses, it's gonna be $25. For frames, as you guys know, for anyone that wears frames, I'm sure you guys are aware it's expensive. You can essentially get $130 off your frames and then 20% off the difference. And that's actually going to be once per 2 years. For contacts, if necessary, it's going to be a $25 copay. And if it's not necessary, meaning you guys just choose to use contacts, it's going to be $60, and that's once per year. And you can't have the contacts and the glasses. You have to pick one of the other. Okay? Yes.
How long does it take to get reimbursed? Or is it like quick or the card?
So with the card, you guys already have it, right? It's accumulating. If $250 if it's by yourself, $500 family, right? Or if you're on the spousal, it's going to be preloaded already. So whatever you have access in that month is what you can use.
Okay.
So
Card swipe.
it's just a card swipe again. Task will flag it if something doesn't look right. That's when you reach out to us, like Amy, I swiped it, they denied it, whatever. I say, okay, you need to submit an itemized receipt saying what the service was for, you know, the patient name, if it's used for your spouse or anything to that nature, whatever. And then you will see that it will clear out.
And it's like I have something that's like $350 for myself, and I use some of my husband's money to pay for it in the month.
What do
Or
you?
are they very
You mean like-
specific?
You mean like if you can use his first and then get reimbursed after? Is that what you're
Or
referring to?
if that goes above the $250 for the month?
No, so it's always
Okay.
it's gonna be $250.
Whatever.
And not to confuse it, right, with the spousal HRA. The spousal HRA will of course cover medical, dental, and vision. But the health reimbursement arrangement that's going to be tied to the medical plan is going to be for the copays, the specialists, the deductible driven expense. So I don't want anyone to get confused thinking that for the health reimbursement arrangement, you could submit dental and vision.
Oh, you can't.
You cannot, no,
Okay, you cannot.
no. For spousal HRA, spousal HRA, yes, you can. Spousal HRA, if you're waiving medical coverage.
Yeah.
You can, medical, dental, vision. The medical HRA, because I know it can get a little confusing, because there's gonna be two different HRAs. The first HRA, if you enroll into the medical plan, you get 3,000, right? 6,000 if you enroll with any dependents. That one cannot be used for dental and vision, because that one's strictly for tied into the medical. Copay is deductible driven expenses, right? You need an MRI,
It's not
pay
free.
150, not free, no.
Correct.
I don't wanna get
vision, you can only do contacts or glasses?
Yeah, it's in lieu. It's a very general plan. It's always in lieu of, you can't do both, but you could do one or the other.
But I can use. What do you call that? I call it
You're waiving, right?
Whatever that money,
If you're waiving the
Yeah,
coverage, then
I can
yes,
just use that.
you can.
Right, and I
Because
get-
she would be enrolling, if you're an example, to the spouse HR,
So if you're taking your insurance.
correct?
And you have the HRA, that cannot go towards my prescription glasses.
Correct. That's why you would then enroll into the dental.
So for everyone's current, so just to make it a little easier, if anyone here is enrolled onto their spouse and then to continue with their spouse, you will have access to the 6,000 for the medical, dental, and vision. If you're rolling by yourself onto Field of Dreams insurance, you will only have access to the regular HRA, which is for medical only. You cannot use the dental and vision. Okay? Just so I know we're getting a little confused here.
It should have been on like two different meetings, one for one for the other. I think it's too confusing for people. You know, because
Whoever needs to sidebar with us individually so we could
no,
break
it's
it
just that
down
a lot
for you, we
a lot of
absolutely can.
people need one, not the other, so it just gets a little confusing, because that's all.
Right, no, it's fine.
Okay, just moving on. Now we have the basic life insurance and the voluntary life insurance. As I mentioned, all of you guys are automatically enrolled into the $50,000 group life insurance benefit. That is free of cost to you. Of course, you just need to elect a beneficiary. You can elect more than one. So if you want to elect your spouse and maybe your children, you can elect them. If you want to go ahead and leave more life insurance, you can enroll. That would be a cost to you. You have access to yourself to enroll up to $500,000. Again, the guaranteed issue amount, I have to double check it here. I believe it might be 150,000. Like I mentioned, it will turn red on the toggle bar, which basically means you will need to submit the questionnaire. I always like to emphasize the life insurance is a great benefit because it's through Field of Dreams, which means if you were ever to try to get life insurance, for example, through Prudential or any other sort of vendor, you will have to go through all these testing and all of that. With this, you just get a questionnaire that comes directly from the carrier principal. And then once they go ahead and approve you of the coverage, you will see the updated pay deductions for that as well. So for example, if you elect 200,000 and it's 150,000 guaranteed issue, you're only going to see the deductions for the 150. Once it gets approved, you'll see your updated pay deductions. And you can enroll for your spouse up to 150,000 and for your children up to 200 or 20,000. Okay? Any questions on the life insurance?
Thanks.
So just moving on, I'm gonna actually pass it off to Mike to talk about the AFLAC benefit.
You guys are probably so sick of listening to me because I talk.
Never.
But you, yeah. Big one button. Guys, for those of you who do not know me, Michael Carey, I live locally. I am your AFLAC representative. I have been for years. Just, you know, again, a lot of this is going to be repetitive to many of you, but high level overview, medical insurance, dental insurance, vision insurance that they're talking about. They pay hospitals, doctors. AFLAC does not pay hospitals and doctors. AFLAC has plans that pay you, the policyholder, directly. AFLAC pays above and beyond anything else that you have. Enrolling in any of the things that you've seen so far has absolutely nothing to do with AFLAC. You file a claim with AFLAC, they don't even ask you about that. Again, we pay you directly and we pay above and beyond whatever you currently have. All right. What I'm going to do is just go over, and there's a lot of good AFLAC information in the benefit guides. These are just sort of overviews that I have here. One of the first things I always talk to people about, it's a little bit different than the stuff we have been talking about, but it's so important for you guys to understand it. AFLAC offers what's called short-term disability. Think about it this way. We have other plans like accident and cancer and hospital. Those policies protect your body. Short-term disability does not protect your body. It protects your paycheck. You guys know that if you ever get hurt on the job, that's what's called workers' compensation. Workers' compensation pays a chunk of your income. It pays your medical bills. Beautiful. The exposure is not on the job. It's when you step outside. If you get hurt off the job, or if you become sick, or if you are pregnant and cannot work, the only thing you currently have is this thing called New York State Disability. Does anybody know how much New York State Disability pays you? It's $170 a week, and it is taxable. Right? You're going to take home about $145. AFLAC short-term disability would pay above and beyond New York State disability. So if you got hurt off the job, you got sick or became pregnant and couldn't work, you can still collect that AFLAC, the New York State disability, but you can also collect AFLAC short-term disability. The combination of the two will get you a little bit closer to being whole. Because I got news for you, while you're out, your bills are still coming in. They don't care that you're not working. They're coming in 100%. So the question you need to ask yourself, and I don't say this to sound corny or salesy or anything like that, never ever ask yourself, oh, can I afford that policy? The question that needs to be, can I afford to not have that policy? And some of you can. Some of you may have a spouse that is making a ton of money, and if you had to miss 4, 5, 6 months of work, your family would be fine. Others, not so much. Others would struggle. If you're in a situation where if you lost your income because of an off-the-job injury, sickness, or pregnancy, please contact me, because once something happens, it's too late. You can't come up to me after you get into the car accident and say, hey, Mike, can we talk about you? No, you cannot. Sorry. Right? Please let me know and we can set you up with income protection. Accident insurance, guys. The accident insurance is AFLAC's most popular plan. You can probably see that medical plan that they're offering here is excellent. I know a lot of you were scared at first about the deductible, but then you see the health reimbursement arrangement that is taking care of the first $3,000. of that $3,500 deductible, but you guys can still see, even with that, there is potential for some out-of-pocket expenses. Right? You get admitted to the hospital overnight, you gotta meet your deductible. Then you still gotta pay 20% of that bill all the way up into your out-of-pocket maximum. AFLAC has plans like the accident plan and our hospital plan that will help insure against that. All right, there's information specifically in there. Again, I will say as long as you guys need, and you guys know I'm right down the road, you can meet me anytime. I'll go over it with you specifically. You can do it over the phone. I'm not gonna go through all the nuts and bolts of it, but I just want to give you the idea of how these plans work. I just mentioned the hospital coverage again. Great way to supplement the out-of-pocket expenses. Right? I don't ever let anybody escape without listening to me talk a couple of minutes about the cancer plan. I know several of you in here have it. First of all, every cancer plan that we offer has a wellness benefit. So you go in once a year for your annual, whether it's PAP, mammo, the colonoscopy, whatever it is, it's considered a cancer screening. Even though it may not cost you a dime, AFLAC still will pay you once per covered person per year for going for a cancer screen.
It's like, say, dermatology separate from gynecology.
It's one screening per person per year, and a regular dermatology checkup will not count. A biopsy will. Has to be a biopsy. I know that, believe me. I'm 19 years cancer free. I had a stage 2 melanoma. I go in to the dermatology appointment a couple of times a year, and they greet me at the door with a scalpel. Something's coming off of me, because they know that they're going to get reimbursed because of my family history. So yes, it has to be a biopsy. But, so that's a great benefit. But beyond that, as far as talking about why cancer insurance, even with the greatest medical insurance. And remember, guys, to get AFLAC, you don't need to have the medical insurance through here. I don't care if you have no medical insurance, you have it through your spouse, through the state, makes no difference. You can still get AFLAC. All right. But as far as the cancer coverage goes, even if you have the greatest medical insurance in the world, and you're diagnosed with cancer, God forbid, and you start off at Garnett, right? And they got a cancer wing and things start to go not the way you want. Where's the first thing they're going to do? Where are they going to send you? Westchester, New York City, right? And I don't care how good your medical insurance is. They are not paying for you to drive down. It's not paying you $18 to cross the George Washington Bridge. It's not paying you $40 to park your car. Do it a few times, no big deal. Do that 3 days a week, do it for 6 months, and look at your credit card. You can get buried financially, and that's non-medical, not even the medical stuff that we're talking about. So that's the why for cancer coverage. It can be the most important thing you get. I hope it's a plan I hope everyone gets and no one uses. That's simple. We do offer supplemental dental. Supplemental dental, again, pays you directly. You go into your dentist just like you normally would. You pay it like you normally would. But then you could file a claim with AFLAC and we pay you directly. Guys, that's the thing you got to understand about any AFLAC benefit. It is a cash-free benefit or tax-free benefit, cash that goes directly to you. You can do whatever you want with it. If you have medical bills, you could use it for medical bills. You can use it for mortgage. You could use it for rent. You can go on a cruise. I don't care what you do with it. It's your money. It is a tax-free benefit. But again, if you get hit with a lot of out-of-pocket dental, take a look at our AFLAC supplemental dental. The one thing I'll tell you right off the bat, though, I'm very, very honest and upfront. Supplemental dental, not just AFLAC, any supplemental dental has waiting periods. So in other words, you cannot get AFLAC dental today, get a root canal tomorrow, and then cancel the plan on Thursday. That's how AFLAC goes out of business really, really quickly. All right. But if you can satisfy the waiting period, you could save a fair amount of money through AFLAC supplemental dental. And just so you know, cleanings and x-ray, no waiting period. You're eligible immediately for those. Okay. And that's a thank you. And that's a duck. You see my phone number. A lot of you have it. I have folders here. So again, I'm going to hang out if you guys talk with these guys, but you have a moment, you want to speak with me, please do. My business cards are in there. You can call me, email me, text me, send me a smoke signal. I don't care. Just get in touch with me however you want. All right. Thank you, guys.
Thank you so much, Mike. Okay, so that actually concludes today's presentation. Again, Field of Dreams is being generous. I know with the Coursera, that's probably the biggest topic. However, they did try to go ahead and still make sure you guys are compensated for your well-being. So you guys have the HRA if you're enrolling onto Field of Dreams, or the spousal HRA. Of course, we don't want you guys to feel worried if you have any questions that come outside of today, or if it comes out throughout the year. We're always here to provide you guys year-round support. You have our contacts at the last page over there. And yes,
And if we're waiving the medical coverage and we're going for the spousal, which is the 6,000 a year. Does that cost us anything? Does anything come, do we have to consider, do we just enroll, do we have to pay?
you just enroll, we'll take care of your guys' enrollments. It's a cost to Field of Dreams. So they give you guys the benefits, so it's no cost to you.
So no cost to us.
Yes, and of course, we just have to set you guys up with the benefit and the
Proof
enrollment.
of your spousal.
Yes,
benefit.
yes, we definitely,
So is that through the email?
yes.
And the proof, by the way, won't go to us, it'll go to Amanda.
Yeah, Amanda will send it, she'll send it over to us.
Or Tara.
Or Tara, yeah.
Not to us.
And her name's interesting.
But you guys will just let us know if you are waiving, and then we'll see spousal, and we'll keep in mind, okay, this person wants to do the spousal HR.
Yes, I jump into-
We'll
Yes.
enroll, it's my waive, and you put, because it'll ask you, why are you waiving coverage? And you'll put spouse insurance, we'll enroll you into the spouse HRA.
Should probably-
It's not until Amanda or Tara's like, hey,
They
wait,
know
Millie, something's off, or we have to remove you, then we remove you. But once you complete your enrollment, we're gonna enroll you as long as we see that you wait because you're on a spousal insurance. And we'll show you the portal, I'll show you specifically, so you can see that you can wait because you're on the spouse's plan. You can actually click it on the portal.
And that's sorry, that $6,000 lasts for the year. So if you don't use that $6,000.
It goes right back to Field of Dreams. It doesn't pay you out.
But it does roll over monthly for the calendar year.
Correct,
Yeah.
for the calendar year, yes, but if at the end of the plan year, you're like, damn, I didn't touch anything, there's gonna be a run out period. Just so you know, what's a run out period? It means that from when the plan ends, you will still have 90 days to submit any claims that you may have had.
Okay.
Just as the current plan that you're on.
If that's six weeks, is it like I can go on whatever site, and if it's FSA available, is that the same?
Correct, it should run, that's a good, yeah, it should run. If you get us denied, it should, because for example, sometimes the tax card won't run if you go, you know how the Amazon now has an FSA store?
Yeah.
Sometimes people, right, will get like, we will deny them depending on what you're buying in your cart. Right? Again, if you run into that problem, you can partner up with us because we're able to know exactly why it was denied.
So we're looking for HRA, we're for shopping then.
No, you're FSA.
It is,
Oh, it's still
FSA, yeah,
Oh,
because it's
okay.
the list that I've been mentioning of the 213Ds are part of the FSA.
Oh, okay.
No questions. Sorry, I don't know if you want to end the meeting.
So she decides to do that. How would the something that's very. She's not. She's gonna get it.
Yeah.
I remember you like you were that or
Yeah, I think, no, you guys aren't in it. Okay, let me just, hi guys, I'm not sure if you guys are still on. If there's any questions, please feel free to reach out to us. I'm just gonna leave this open for a couple minutes if in case anyone wants to share a question.
Hello, I didn't get an email yet for enrollment.
Call someone's name.
What?
Call someone's name.
Hello, Amy? Why did it go quiet? I know, that was weird. I'll just send out an email.
Oh, it's gonna be 45 minutes. It took too long.
I know.
What?